By session 6 and 7, this is where they're learning to self-challenge and starting to put a lot of these pieces together. So you'll be checking in about the patterns of problematic thinking worksheet. And now you're going to be introducing the CBW, or Challenging Beliefs Worksheet. The reason that is so important that a patient has been completing their homework assignments is because they're building blocks, right? So by the time you get to the CBW, none of the pieces of this exercise should feel super surprising, because it is kind of the combination of a bunch of skills you've been working on. So you have that initial ABC section, which is activating event, belief, consequence, what happens. It also then incorporates patterns of problematic thinking. So they'll be able to then look at the thought, belief in column B and see, are there any patterns of problematic thinking here? And if so, how? They will also be able to then use the challenging questions on that same worksheet to challenge that belief, right? So all of those together. And now on the Challenging Beliefs worksheet, they are also going to re-rate how much they believe the particular thought that they started off with. If they're able to come up with an alternative statement that is more kind of grounded and factually based on all of the aspects of the exercise they went to. And when you introduce the CBW, or Challenging Beliefs worksheet, you're going to do that with a trauma example. So every practice assignment that you do in session, before you send the patient off to do it, you will go over an example together so that they have a reference point. So they now are moving into specific trauma examples, trauma-related examples, and looking at, how do I use a CBW to address a trauma-related belief, such as I can't trust anyone, or I am worthless because I couldn't protect my friend, right? Those types of beliefs. And then once you get into session 7, once the patient is now using the CBWs, and you, by reviewing the worksheet with them, you know that they have a grasp on it, now you're going to move into looking at specific trauma-related themes. So session 7 is going to introduce the safety theme and talk specifically about how trauma impacts safety, how it can shift how you think about safety, or how it can reinforce unhelpful beliefs that you already have about safety. You're always constantly throughout checking the client's reaction to the session, right? Checking in about how it's going with completing the exercises. At any point, if there's something that comes up that is disruptive in the patient's life, that is going to impact their ability to show up consistently or fully participate in it, you would think about if it's a good time to continue this particular type of treatment. That goes without saying, but I'll still say it anyway, because it is a protocol treatment. And of course, we want to make sure that we're using our therapeutic skills to kind of assess for and continue to pay attention to how people are doing. If they're not engaged, what are barriers, right, to showing up for treatment? Things that commonly get said by clinicians or medical is like non-adherence, right? Things of that nature. And we can think about, if we're being culturally responsive, how that is sort of clinically rooted and assumes that people kind of have all the resources and everything they need to show up every week and don't have other things going on, where that might not be the case. There might be some barriers that impact access to care. And so if that's the case, troubleshooting, checking in with a patient about what is getting in the way, if this is the best time to do CPT, and if not, thinking about other ways of supporting them in therapy until they can restart. What you don't want to do is start having supportive therapy sessions that are not in line with the protocol in between, and then just jumping in and out of CPT. You want to make sure that you're working with a patient at a time where they can and they are able to commit to it for the duration of the treatment. And a metaphor that sometimes we might use is be like taking part of a medication dose or not taking it every day for people who can work with medication metaphors. But you want to be clear about like what an appropriate dose of CPT is and how often they need to be meeting. At the very least frequent, if someone can't make every week, you could do every 2 weeks. You just make it clear that, you know, that is lengthening the time of treatment in a way that doubles the treatment time, right? So we're talking 12 weeks, which is about 3 months versus 6 months at the minimum. You don't want to do less than every 2 weeks. Weekly is the most ideal. And if you're doing every 2 weeks, then it definitely needs to be consistent. It can't be now we missed a session and it's a month, right? Because again, building blocks and also helping to make sure those skills are being practiced regularly.